My name is Dr. Richard Crook, and I came to Advanced Body Scan approximately 3 years ago. My cardiac story actually probably begins about 8 years ago. 8 years ago, I was still employed at Baptist Medical Center in the emergency department, where I worked for a total of about 30 years. And I decided to get a routine scan then because they were being offered to employees. My scan showed that I was in the 60th percentile at that time. And it was explained to me by a cardiologist friend of mine that I had more calcium in my arteries than 60% of the population my age. And his recommendation, since I had no symptoms, was to have another scan in 1 year. So being a non-compliant doctor patient like I am, I waited 5 years because I wasn't having any symptoms. But I was feeling fine, and thought, well, I don't really need to do this. And then finally, 3 years ago, which would be 5 years from my first scan, my employer kept suggesting to me over and over again to get it, and I kept saying, I don't really need that, I feel fine. And he kept saying, why don't you get it, why don't you get it? So I finally decided, no, I'll do it just because it'll satisfy him. So I did it. Lo and behold, I'd shot up into the 90th percentile, 90th plus. And so obviously felt the need to go back to my cardiologist friend. And since I wasn't having any symptoms and no electrocardiogram changes, he elected to treat me medically. So put me on some appropriate medications and dietary restrictions and so on. And then I noticed when I was out walking my dog that I started to have kind of strange back pain. So I thought, well, maybe that's really hard pain. So I called my cardiologist and told him that, and he thought, well, if you're symptomatic, we're just going to have to go ahead and do a heart cath. So one of his partners did the cath. She came in with this rather frightened look on her face and said, well, you've got multiple lesions and I can't get to them to do an angioplasty. You need bypass surgery. And I said, well, when? And she said, well, right away. So apparently at that time I was hearing for the first time that I had 5 blockages. Only one of them was in the left main, which is where the widowmaker, where you can have sudden death, and it was 50%. But I had 4 other lesions in the other right coronary circulation that were critically narrowed, and I was just waiting to have a heart attack. And I underwent my bypass surgery successfully, and from all accounts, it's probably a good thing I didn't wait any more than that, because I was just waiting to have the big one. And so since that time, I have been very thankful to my employer who kept hounding me until I got this scan done, and to Advanced Body Scan for having the EBT scan technology. Since that time, I've been on medications, appropriate medications to manage my blood pressure and my lipids and so on. And I remained asymptomatic. I can do whatever I feel like doing. I have no symptoms at all. I walk 4 or 5 miles a day with my dog and can exercise with no problems whatsoever. And I'm just grateful and thankful that it all turned out the way it was. I mean, luckily I had a wonderful surgeon, wonderful cardiologist, wonderful care, but had I not gotten the scan done at Advanced Body Scan, it would have been a far worse outcome. Probably wouldn't be sitting here talking to you guys today. I'd be sitting around puffing and wheezing on some oxygen somewhere. So that's my story.